you know, diabetes is a comorbidity. You can't have diabetes without the cardiovascular effects. And so the big push with our American diabetes educators is to make sure that we're retraining and training up those comorbidities. We're trying to take the silos out of those two disease states and bring those together so that we can meet the need. Most persons with diabetes, unfortunately, will pass because of stroke or cardiovascular event.
Welcome to the Pharmacy Quality Solutions Quality Corner Show, where quality measurement leads to better patient outcomes. This show will be your go-to source for all things related to quality improvement and medication use in healthcare. We will hit on trending health topics as they relate to performance measurements and find common ground for payers and practitioners. We will discuss how the Equip platform can help you with your performance goals, and we will also make sure to keep you up to date on pharmacy quality news. Please note that the topics discussed are based on the information available at the date and time of recording. Information or guidelines are updated periodically, and we will always recommend that our listeners research and review any guidelines that are newly published. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. Welcome back to the PQS podcast, where we focus on medication use, quality improvement, and how we can utilize pharmacists to improve patient health outcomes. I'm your host, Nick Dorich, and on today's show, we are beginning a new series for the month of November. Each month, there are numerous recognitions or awareness themes related to healthcare or specific disease states. When I tend to think about the most recognizable, there are 2 months that I was familiar with even before I became a pharmacist or even before I went to pharmacy school. First one that comes to mind, that's February, Heart Health Month. The second is November, and that is Diabetes Awareness Month. So we plan on releasing this episode the first week in November, and this episode kicks off our series for diabetes. This month will bring you a number of specific topics related to managing your patients with diabetes. But before we get into those specific topics, we are starting off with a general overview of diabetes and how a pharmacist can help manage a treatment plan for patients with diabetes. With that, I'm going to go ahead and introduce our guest for today. And our guest is a recognized expert in diabetes management and, in general, a fervent advocate for pharmacist-provided services. That guest is Starlin Haydon-Greatting. Starlin, welcome to the Quality Corner Show.
Thank you so much. I'm so humbled and honored to participate. I listen to your podcast, and this is very important about our pharmacist role with diabetes management.
Well, Starlin, we're excited to have you. And I do have to note, you, as someone who's listened to our podcast before, you get the special award for actually being the guest on our 100th episode of the Quality Corner Show. So we're going to have a lot more to kind of promote and share about this. It's been a wild ride as we go through for 100 episodes, but quite the milestone to hit triple digits, and excited to have someone such as yourself here for the PQS Quality Corner Show's 100th episode. Now, Starlin, before we get into talking about diabetes and how pharmacists help patients manage their diabetes, we need to hear about you. So can you provide us a quick rundown on your background in pharmacy, your background in healthcare, and can you help tell us a little bit about what you do now?
I will try to condense it. It has been 40 years of pharmacy practice and 5 years of pharmacy school, so that's 45 years. But my best friend's father was a family practice doctor, and we used to clean out his office, and his office was next door to Gimme Drugs. Yes, that's what the name is, Gimme Drugs. It was Ken Gimme's store. And so we started cleaning the pharmacy as well to earn money so we could go on Girl Scout trips. They all made fun of me because I love the smell of all the medicines, the sulfur and the penicillin. And anyway, I won a high school science fair competition, and my chemistry teacher suggested that I would be a great pharmacist. And Dr. Taylor and pharmacist Ken Gimme also. So that's how I started into the pharmacy world. I was interested in diabetes because my grandmother had diabetes, and we only had one drug to treat it. And so that that pinned that process. I attended the pharmacy school formerly known as St. Louis College of Pharmacy, and I took a deep dive into pharmacy policy and curriculum. We were the class of 80 and 81. Those classes were the pivotal classes that started trying to convert all to the PharmD programs. So I represented the College of Pharmacy at the AACP summer meeting, and I got to meet all the movers and shakers of each of the schools of pharmacy. So Lucinda Main, and you name somebody that's in association management or dean of a college of pharmacy during the 70s and 80s, I met them. And so we had this great interaction, and I drank the Kool-Aid. I knew that pharmacy needed to be pushed a little forward. We were limited in what we could counsel the patient on for their prescriptions, and I just didn't think that was right. And so I've been a capstone for this process from the very beginning. I was able to do a residency with the Indian Health Service, and that was even more Kool-Aid, right? Because they had team-based care in the 70s and 80s. And I came back to the lower 48 going, why aren't we practicing this everywhere? And that became my second mantra. So I worked hospital pharmacy for a while. I did a small rural hospital. My husband is also a pharmacist, and he was first in our class. And I came back from Alaska going, you need to be in med school because I need a partner so that I have a champion to move pharmacy forward. And so he went to med school. So they do 1 year in Southern Illinois, and then they do their other 3 years up in Springfield, which is how I ended up in Springfield, Illinois. So what happened is I always got put into a situation where someone hadn't done the process before. And instead of saying no, I said, give me 2 hours and I'll be an expert at it. So I moved up to Springfield to an 800-bed hospital. And the clinical coordinators back then, we did everything. We were kind of an octopus of pharmacy where we did infectious disease and the pharmacokinetics and nutrition rounds. And I did everything I could to get out of checking carts in the basement of the pharmacy. So while I was doing that, I had a set of twins and a little boy. And so to pursue the PharmD didn't really work for me because I was already experientially trained up to that point. But so I went on and got a dual master's in Master's of Science in Hospital Administration and my public health. So I have a dual degree. And during over 90, I was asked by some great friends in Washington, D.C. to come out and do a healthcare and public policy rotation. And I ended up staying and going through APHA, ASHP, ASCP, and it's now known as AMCP, but they were just called managed care, but they are now called AMCP. So I covered the over 90 and Medicare legislation because Senator Paul Simon is the Illinois senator, and he was the chair of the Ways and Means Committee. And my mom went to high school with him, so I called her and called in a favor to see if I could. We couldn't get into his office, and we were trying to cover the over 90 legislation. And once my mom, she called him, and I went in and sat down with him, and he learned about all of our background and what pharmacists do. And so I stayed on as an intern with him throughout until they passed the process. And then I finished that all out and continued to write for our pharmacy associations, and so that we bridged that gap. When I came back to Illinois, I started a consulting business because I, as a busy mom, I didn't think I could work 12 and 14-hour shifts. And I was working relief in a community pharmacy that I was providing long-term care consulting for. And the governors came to the pharmacy and all the black cars, you're sitting there and everybody's going, oh, the governor's here. And he walks straight back to the pharmacy and wants to know if Starlin Haydon is around. and everybody points to me because they think I'm in trouble. And then the governor came and said, we'd like to hire you to do a strategic plan on over 90. So that I was only supposed to be doing over 90 for Illinois for 6 weeks. And then 23 years later, I finally put a close to what I had done. We brought informatics. We did the online claims processing. We were the first state to come up with that. I had a prospective drug utilization review process and a vigorous quality assurance program for both pharmacy, nursing homes, and physicians. So kind of, I didn't leave it there. So I kind of took a year off, and because it was a lot of, I have stories that we can all talk about later. But I took a year off, and during that year, Bill Ellis and Tony Farah reached out to me and said, we're doing this thing called Diabetes Density Challenge, and we need somebody with research skills and knows how to manage a large program. And so I volunteered to be part of a meeting, and then now I've been the director of Illinois' program since 2005, and we've sustained the program.
That's excellent, Starlin. And while we focus on diabetes for today, I'm putting a note in my notepad here. We may need to come back and talk policy at some point with you as well. But we are going to talk diabetes for this episode. And before we do that, we're going to stop and we're going to play the breakdown.
Now it's time for the breakdown. As Quality Corner show host, Nick will ask 3 main topic questions. Our guests will have a chance to respond, and there will be some discussion to summarize the key points. This process will repeat for the second and third questions, which will wrap up the primary content for this recording. After that, expect to end on a closing summary, usually containing a bonus question. Now that we have described the process, let's jump into the questions.
All right, Starlin. So today we're talking diabetes management as part of November and Diabetes Awareness Month. And before I get into the questions for you today, I'm going to cover some quick facts from the CDC regarding diabetes. So this may be old information or information that folks already know, but we're just going to cover it and talk a little bit around prevalence and expectations for diabetes. So currently, more than 34 million Americans are expected to have diabetes. An additional 88 million Americans may have prediabetes, and diabetes and diabetes-related outcomes are the 7th leading cause of death, associated deaths in the United States. We obviously do know there are both type 1, type 2 diabetes. Type 2 diabetes is accounting for roughly 95% of cases today. Now, Starlin, I do want to hand it off to you because you're more of the clinical expert than I am. We want to talk a little bit about what pharmacists can do with diabetes management. So how are pharmacists, but more specifically community pharmacists, helping patients with diabetes manage their disease state?
Well, so you know that pharmacists represent the 3rd largest health profession. So if you measure us against doctors and nurses, so we're 3rd. But I think we don't have enough doctors, especially in underserved areas and in those community settings. And we work well with nurses. I personally am a diabetes care and education specialist. I'm also credentialed in the Diabetes Prevention Lifestyle Program, and I am also credentialed as a chronic disease management person through the National Association of Chronic Disease Directors. So I work with the Public Health Department for that chronic disease arena. Pharmacists, we are cut out to do this because we are able to translate large information, all the clinical information, all the measures and metrics down to the level of the patient so that they can understand it, bring it up for the nurse and the support staff to be able to help in that team-based care that we use in diabetes education, and relate well with the physicians or the nurse practitioners that are managing the case, so that there's a full 360-degree circle around each person with diabetes that we're taking care of. Most pharmacists do work in the community. It doesn't matter what practice site you're in, corporate, retail, AmCare. Anywhere where any patient walks up to us, we have become the first port of call. And what I mean by that is if someone is driving across Kansas on Highway 70 and they are not feeling very well, they're most likely going to stop at a practicing pharmacy to find something for their upset stomach, try to talk to someone, and then get the pharmacist and find out, well, they forgot to take their medicine, and it was in the trunk in the suitcase. So that medicine might be a medicine for diabetes, and so that's suddenly that pharmacist is intervening in a positive way to that patient's process. Going forward, pharmacies and pharmacists can participate in diabetes self-management education programs, and there's a commercial side, and then there's one. DSMT is diabetes self-management training. That's the Medicare side of it. You can become accredited through the American Diabetes Association or the Association of Diabetes Care and Education Specialists. And we are paid. We are paid for delivering that 10 hours of diabetes education, and then for 2 hours after that. You can partner with a registered dietitian. She can bring that to your community pharmacy, and then you can also bill for medical nutrition therapy. For DPP, Diabetes Prevention Program, by the way, we don't really ever call it diabetes prevention because 95% of the 95% don't think they have diabetes, so they don't answer the call, would you like to enroll in a diabetes prevention program? So it's more locally called a lifestyle change, or some of the YMCAs call it weight loss, but pharmacies can be DPP providers. And that is the big project that I'm working on right now. Each state received an 1815 for the state or an 1817 for a large metropolitan area through CDC to embed more pharmacists into team-based care directed toward diabetes prevention, diabetes, blood pressure control, lipid control, and the prevention of stroke. So we have the momentum right now to seed projects in each of these states, and each state is doing it slightly different. What we're doing here in Illinois is we have identified 44 counties in our state that are underserved. There are not enough health professionals to deliver the necessary care to bring up that health equity. So we have 44 counties in Southern Illinois, and then we have small areas around the large urban Chicago vicinity and in Central Illinois around East St. Louis, where there is deserts of grocery stores, pharmacies, and health professionals. So we're using the grant money to seed pharmacist-delivered diabetes care, whether it's prevention, lifestyle change, or any level of that curriculum for blood pressure, cholesterol, and stroke. You know, diabetes is a comorbidity. You can't have diabetes without the cardiovascular effects. And so the big push with our American diabetes educators is to make sure that we're retraining and training up those comorbidities. We're trying to take the silos out of those two disease states and bring those together so that we can meet the need. Most persons with diabetes, unfortunately, will pass because of stroke or cardiovascular event. Another thing that is important to note is there are many hybrid models of this delivery. We have schools of pharmacy that are embedding ambulatory care pharmacists with community pharmacies in kind of a triangular care in underserved areas to take care of people that don't have any insurance and haven't qualified for Medicaid. And those, what I call those hybrid models, are very successful. With a group of other health professionals, we just finished a systematic review on the economic impact and health care utilization outcomes of diabetes and self-management education. And we started with 16,000 studies and articles, and we narrowed it down to 22 that had great cost information and outcomes. And 5 of those 22 studies involve a pharmacist in a community setting to deliver that high level and high touch care that our people with diabetes need.
Well, Starlin, that's a great point for us to go forward here. And there's so many different aspects of care. Like you said, with diabetes, it's not just about the blood sugar that we're talking about. It's going to be related to blood pressure, lipids. So I'm going to go to our next question, and that's going to focus on medication, clinical guidelines. Those items can always be ever changing for best treatment or best information we have with the disease plan. So, what new clinical guidelines, management, treatment opportunities should pharmacists be aware of as it relates to their patients with diabetes?
Well, first, we need to be involved in our team-based care by looking at preventative services. So the United States Preventative Service Task Force does guidelines and evidence-based medicine for screening in primary care. And some of the newest updated screenings are for diabetes prevention, diabetes, gestational diabetes, and many others. They're kind of the clearinghouse for those prevention screening guidelines. So we should start there, because just like we're advocates for immunization, we need to be advocates for reaching out to our patient populations to discover what their risks are. And then, of course, the American Diabetes Association every year does a standard of medical care in diabetes. Now, that used to be a stagnant document. Remember when all of our guidelines were stagnant documents? They're no longer stagnant documents. They roll. And so keeping in mind that as new technologies, meaning digital technology and chemical technologies, come out, it changes. I've watched the treatment algorithm for ADA and the American Association of Clinical Endocrinology change 4 times in a 1.5 year period. So when there's a breakthrough or the CVOT results come out, there's an adjustment. They really did come out this year and say certain medications are not preferred to be used unless you have nothing else, that to go to some of these new treatment medication classes, because their treatment does not only help with the diabetes, but helps prevent that cardiovascular negative outcome. So I mentioned that ACE, American Association of Clinical Endocrinology, they have their guidelines. By the way, all these programs now have apps, so you can download them into your phone or your tablet, so you have them with you to see if there's any new changes or to confirm some things. I would be remiss without mentioning the ACC and AHA guidelines, which is the American Heart Association with the American Cardiology. They gave us our risk calculator, our CV risk calculator, and that's a must. All of these guideline groups are actually talking better with each other, and people serve on each other's review committees, and so we're trying to, again, get rid of the silo of practice so that we're all working together on that. The other important areas as pharmacists that we need to look at is we do need to look at what AMA is printing. They have their own set of guidelines, and the American Association of Family Practice Docs, and then there are others. So don't be afraid to go outside our pharmacy world and look at what the physicians are saying. That'll give you a hint when you have those collaborative relationships, that maybe what they're thinking in regards to the treatment protocol and management of the patient. On the other hand, those healthcare stakeholders sometimes come to us because like I said, we are so well suited for digesting all this information and organizing it and being able to apply it, that we become very many times the primary source in team-based care for this information. I am PQA's representative to the National Quality Forum, and the National Quality Forum is a clearinghouse of the quality measures. So I'm on their endocrine steering committee, which covers diabetes and all endocrine primary care measures. And I have been part of reviewing, the national NCQA, Medicaid, and Medicare. So we've reviewed all of the adult healthcare quality measures for Medicaid, for the 5-star, for the merit base, for the Medicare shared savings, the ATOs. So all these initials are things that we all should be aware of. Now, you say, well, I'm just a community pharmacist and I don't have all the time for this. You're not just. First of all, get rid of just. Take that out of there. You are a great community pharmacist who sees patients 360 days a year versus 2 to 5 days that a health system may see them. So you're the most accessible. There are ways of reviewing all this. There are newsletters, there are summary. Our associations that we're members of help crunch this down into palatable information. Look what we've done when we pivoted for COVID. We can do the same thing for diabetes. And for Diabetes Month, it's really important that we help maintain our people with diabetes because they're at a high risk due to their diabetes in the first place. And I want to compliment all the pharmacists out there that ran toward the fire. We didn't start the fire, but we ran toward the fire, and immunization is just as important as that diabetes management plan. So I want to thank you for that.
Excellent point, Starlin. And with that, I want to focus on your comments around pharmacists being that expert in the care team. I really appreciate your comments on getting rid of the just a community pharmacist. Everyone is a trained clinician, right? Every pharmacist is a trained clinician. It's up to us to use that skill. So for pharmacists, what recommendations do you have so that they can and will stay on top of the latest information for diabetes management? Are there any, key contacts? You mentioned a number of organizations, but is there anyone or any ways in particular that you recommend pharmacists can stay on top of that information?
Well, I'm an appaholic. I have lots of apps on my phone, and I really enjoy social media. You're talking to a person who worked for fax comparison when we typed the pages. So getting away from paper and going toward using social media and joining LinkedIn and following the big national organizations that have to do with any disease state, but particularly, ADA and ACE and the Association of Diabetes Care and Education Specialists. Got to call out all the pharmacy silos: APHA, ASHP, ACCP, ASCP, AMCP, because everybody has a slightly different turn on what's happening because of who they represent, right? So you've got it as an informed person in community. You have geriatric patients. You're dealing with managed care because that's our life. We have all these insurance policies and the pharmacy benefit manager rules that we have to go through. And then ACCP gives you a different side of the clinical process. And then ASHP and APHA will give you that great base knowledge. Now, everybody has certificate training programs. So if you've been behind the counter a little too long and you feel like your clinical boots are too dusty, each of these organizations have a certificate program where you can earn over 20 hours of continuing education and dust off those clinical boots and jump right back in. And what's nice about it, all of our organizations We update them every year with all the years. So if you wanted to, you could take them every year, but we recommend that about every 3. So that's just a starting point. We start with that, and then we move forward with that experience level and getting into some diabetes specific meetings, reading articles that are published in all the journals from this program. What I like about Twitter, I can literally search on hashtag diabetes, and if I got behind in all my paper journals, I can see the hot topic news that comes right off there. Follow organizations like Pharmacy Quality Alliance and PQS. You're there to make us look better, and so therefore you're a great resource for information. The other thing is I do follow like Susan Cornell, Dr. Cornell, Stuart Haynes, Diana Isaac. Diana Isaac was a student of mine. She's an SIU grad. She has become the digital diabetes technology guru. She's at the Cleveland Clinic now, and you've got to follow her because she gives you the tweets. Dave Dixon for cardiovascular, Joseph Sassine, and then for informatics, Shelley Spiro. So I do LinkedIn, Facebook, and Twitter, and I have Instagram. All those, everybody that's on here, if you're not involved in that social media, that's your instant feed. And so when you're waiting for a bus or you're waiting for somebody to pick you up, you can see those bits of information, and then you can go to the source later when you have more time to dig into it.
Excellent, Starlin. It is amazing to me how we've gone and how things have changed in a relatively short period of time for social media, where it is now, because I use it in much the same way, where I have my curated list on pharmacy, healthcare experts, certain disease states. There's absolutely great people out there that are sharing information, and often looking through guidelines is they're lengthy, right? Let's be real about it. Guidelines and updates are going to be lengthy. Having people that are really experts in those areas that can help actually distill it down, even to a couple of tweets. Now, I want to be very clear. I don't recommend that as your full, CE content. It's not going to be CE content. It's not going to be, go and read it at some point. But if you need a simple description just to kind of keep up on the big topics, there's some great people, including many of those that you mentioned that I follow myself, that are great for that kind of content.
Well, Josh Newmeyer, he's on the ADA Standards Committee, so it's one of our first pharmacists that is moving up in that organization. The fastest growing for all these organizations, the fastest growing profession in non-pharmacist association are pharmacists. ADCES and ADA and ACE and the cardiovascular group, the pharmacists that are hungry are joining those organizations and becoming part of that team-based care. So the other nice thing is having webinars and podcasts to crunch that information. And the podcasts are great because when you're driving, you attach it to your phone, run it through your radio, and you get some updates without having to be too upset. In Illinois, we all have lots of flat land, so when I'm driving, I need some CE podcast. I don't really need the continuing education. I just need a continuing professional development. So that's what you have to get over too. Some things you do just for the professional development. Yeah,
you always need to be learning, always need to be growing and stretching that. It's not an actual muscle, right? But we do need to be learning and growing in that sense. So Starlin, with that, I'm going to wrap us up for today in our introduction. Just what can pharmacists do about diabetes management? We've got a number of upcoming episodes that are going to have a deeper dive into diabetes management, including potentially some of the folks that you had mentioned or you had named as experts in this topic. And we're really excited to spend this time to help pharmacists keep their knowledge current around diabetes management, but also how they can continue to manage it going forward. Diabetes is a prevalent disease state that pharmacists can help manage, whether it's the A1C test, whether it's managing blood pressure, health coaching, diet planning. Starlin, I think I'm missing a few other items that you had mentioned. Another thing that's really big for patients with diabetes, making sure that they're up to date on their immunizations. That's a huge one. We didn't even get to address that at length, but that's another very big topic. But there's a lot we can touch on. and that we will talk about later this month. But now we've reached the point of the episode where we do have a question for our guest that is not specific to pharmacy, not specific to our topic of the day. Starlin, I do want to hear from you. We are a podcast about quality improvement. And before we close, have you learned any new skill sets in the last year and a half? Are there existing skill sets that you've really honed in on? What have you been doing for your own self-improvement, your own quality improvement plan?
In this past month, we've been working on trauma-informed care, and it not only is going to improve our quality of care for the persons with any disease that we deal with, but it's going to help us. With me being involved with the Illinois Pharmacists Association, while we went to the fire and we've tried to put it out, we're kind of burnt out. And so COVID is kind of post-traumatic stress disorder. So I'm really enjoying the trauma-informed care practices and trying to elevate that into our programs, because I'm really finding more about me. We talked about how I got into pharmacy and diabetes. It was, I had a grandmother that died early in her life, and so that's the key. So I feel like I need to hold more hands and be more gentle and be more supportive, and I generally am. People call me pharmacy mom, but this trauma informed care really pivoted me even more, especially nowadays in today's environment of what we're going through. And so that's what my goal is to move forward with that.
It's a great shout out, Starlin, and thank you for sharing that with us. I certainly agree, and something that's important for all of us. Now, Starlin, before we do close, our other question for guests at the end of the episode here is, how can they contact you? So if somebody does want to hear about your work in the diabetes space and some of the projects that you're working on, what's the best way to contact you?
Well, you can Google Starlin Haydon-Greatting. I'm the only one. And I tell my students that all the time. How do I do that? I go, you guys are the Google people, but I'm on every social media. I'm on LinkedIn, and Twitter. I'm at Starlin RPH, Facebook messaging. I will give the IPHA general phone number out. It's 217-522-7300. And you say you want to get a hold of me, and Jamie will text me, and I'll call you back and leave your email, and I'll send you a message. But you can, on LinkedIn, I can get you my email as well. So I'm pretty open, and I would love to work with anybody who's interested in providing these services, or any pharmacist, what I call pharmacist-centered and delivered patient care.
Excellent, Starlin. Well, thank you, and appreciated the conversation today. Normally when we do these podcasts, I like to keep myself on mute just so we're keeping background noise to a minimum. Probably might have been a good thing today, as I had quite a few laughs as you're going through for your points here, whether it was talking about the great driving that you have in Illinois, or your addiction to apps, or use of Google, et cetera. That's there. So I appreciate this was a fun episode for me to record, and that always makes it a little bit easier. But we also had a great conversation and talked a lot about important information for pharmacists and diabetes management. But again, for our listeners, this is just the beginning of our talks on diabetes. Starlin, again, I do appreciate you appearing on the show. And with that, it does wrap up our content for today's episode. So for our listeners, make sure you subscribe to the podcast. And if you have a question or topic, please let us know. Similarly, if you have a topic that would like to come on the show and talk about it, we'd love to hear about it. DM us directly on Twitter at Pharmacy Quality, or by emailing info@pharmacyquality.com. And with that, I appreciate you, the listening audience, for the Quality Corner Show. But before we go, there is one final message from the PQS team.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.